What should be the gap between the two babies? Now that you have delivered your first baby, you're thinking, what will be the right time to plan for the next? See, whenever you go through a pregnancy and a delivery, there are a lot of changes which happens in your body. Your body is going through a lot of things. There is hormonal changes, there is blood loss which has happened, the joints are weak, the bones are weak, bone density has reduced. So all these changes has happened during the pregnancy and during the delivery. So after delivery, which is a big event, you need to recover your body, you need to get back your hormones on track, you need to gain your bone density back, you need to build up your hemoglobin before you plan for the next baby. What will happen if you plan an early pregnancy? That is, if the gap between the two babies is less. If it happens so, then there can be nutritional deficiencies in the mother. The hemoglobin can be low during the pregnancy. The mother can suffer through joint pain, backache, bone pains throughout the pregnancy. Apart from that, there can be increased risk of pregnancy related complications, like there can be a higher risk of abortion, preterm delivery, then BP, hypertension, sugar. All these risks will increase if you keep a gap less between two babies. So now, what is the ideal gap between the two babies? So the ideal gap depends upon the outcome of the first delivery and also on the age of the patient. So if the first delivery was a normal vaginal delivery, a minimum gap of 1.5 years and preferably a gap of 2 years is required. Whereas in case the first delivery was a cesarean section, then you should keep a minimum gap of 2 years and preferably a gap of 3 years. If the first pregnancy was an abortion, you landed up in an abortion, then we advise a gap of 6 months after the first abortion before you plan for your next baby. And if in case you want it early, then you can plan as early as after 3 months of the abortion. So it also depends upon the age of the patient. If the age of the patient is high, that is more than 36 years or 37 years, you can plan a little early. You can keep a lesser gap between the two babies. However, if you're young, like if your age is between 30 to 35, then you can keep a gap of 1.5 to 2 years between your two babies. Also, you should be mentally prepared for having a baby. So whenever you are mentally prepared to have your second child, then only you should go ahead and plan your pregnancy.